Overall, the report says in the first 6 months of our year, the MHA's 70-member hospitals lost more than $400 million. That's double what they lost in the same time period last year. Those who track this issue nationally say the headline is certainly alarming. But to better understand what's going on, they said we need more details about what is leading to these losses and which hospitals specifically are going through them. Unfortunately, that level of detail has not come. Here's Kent.
Jana, the Minnesota Hospital Association told us that in order to give this kind of a statewide snapshot of how dire the situation is, they say, they promise to keep individual hospital data private. But experts say that makes it impossible to really get inside this issue and solve any underlying problems.
Before there's any discussion of solutions, there needs to be more disclosure.
Dr. Vikas Sani is president of the Lown Institute, a healthcare think tank that's followed the struggles faced by hospitals across the country since the pandemic. But he says he's surprised by the limited information indicating Minnesota hospitals, not including Mayo Clinic, have seen 2023 losses nearly double over the same time last year, and operating margins plunge even further. He says a recent analysis by Kaufman Hall found that margins nationally have been slightly improving this year, including in the Midwest.
Unless there's something about Minnesota, or maybe it's because Mayo's not being included, it makes some of the numbers, I think, hard to compare apples to apples. Most importantly, I think you need to see, are there certain patterns in the types of hospitals that are struggling and those that aren't?
The Hospital Association did indicate that the situation is most dire for rural hospitals. And while surveys indicate that labor and supply costs have both cut into bottom lines, it cites the continued rise in the number of Medicare and Medicaid patients as the biggest concern.
This year, we're looking at over $2 billion of underpayment from these two governmental programs just for Minnesota. So that's the first thing that really the state can help.
The question of reimbursement rates and costs is not straightforward, though it sounds like it when they portray it that way.
Dr. Sani says there's no doubt issues surrounding Medicare will only grow as baby boomers age, but he says it's an issue no one state can tackle alone.
There are healthcare institutions which everyone reveres in every community in the country. If they're going to stay solvent, which is in everybody's interest, that it can't be business as usual, that you send a bill and that's it, you get paid. We're going to have to look at how we do things. It means there's going to have to be a much greater interaction between payers, providers, and communities to really understand how we're structuring healthcare. If we don't do that and we just keep on the same merry-go-round, we're just going to have this conversation every few years.
Yeah, very true. Although the problem may go further than Minnesota, our hospital association says it plans to take their requests to state lawmakers to protect patient access across the state, because the survey indicates that more than half a dozen rural hospitals could have to just shut down, they claim, if action isn't taken quickly.